Hello, everyone. It's another day with your fertility specialist. Yeah, it's Wednesday. Happy Salah to our brothers and sisters, our Muslim brothers and sisters out there. We hope that you get the blessings of the season with love from us at Alps Hospitals. I'm your host for today's session, Ruth Ogogo. And today I have a guest with me. Yes, it's been a while we had him on set, so it means that he's giving us a Salah gift by his presence today. Yeah, it's Dr. Kenneth Iguda. Dr. Ken, it's good to have you.
Yeah,
It's been a while.
I'm happy to be back.
Oh yeah. So
Good to be
yes,
back,
yeah,
man.
it's
It's
good
been
to
a
have
long
you.
time.
Exactly, really a long time. I
Yeah.
know our viewers are really happy to have you. So I'm sure that there's a lot for us to learn today. So while we're starting, please call up someone, share this link with someone, whoever you need to see this right now. Call up your brothers, your fathers, your boyfriends, your husbands, or anyone you need to know to see this, to listen to this. Please ensure you do that right now as we're about starting. Drop your thoughts, your comments, your questions in the comment sections, and we'll definitely engage you and respond appropriately. Today, we're talking about when male fertility needs surgery. So, I was just thinking, when do you really say a man is fertile? Because, sometimes a lot of men will just wonder if they tell them something is wrong, they'll be like, okay, so what's this thing that is coming out? So why will you tell me there's nothing or is little or the count is low? So when do you say a man is fertile?
Well, if the woman has a proven track
Okay.
of being fertile,
Oh.
and the only reason why they are not getting pregnant is because of the sperm. In which case, maybe the sperm is too low based on what is accepted to be low at that
Yeah.
time, or has morphological abnormalities, or had movement abnormalities with the movement. The sperms are not moving adequately. When there are no sperms at all, or even when there are enough sperms
Yeah.
that meets all criteria based on the conventional regular evaluations,
Yeah.
but there is high level of oxidative radicals in the sperms that still makes them unable to achieve pregnancy. Because occasionally you have sperms that are very many that meets the requirement for count, movement, looks as a morphology, but yet they have some inherent abnormality because of oxidative stress or damage to the DNA in the head of the sperms. So when a man is in these categories, all not being able to achieve pregnancy for any of these reasons, he'll be described as being infertile.
Infertile. Okay. Let's see. Okay, so
So
for the
it's not
sake of
all about the count. It's not all about the motility. It's not all about the morphology. It's also about the intrinsic quality of the sperm. And these are what you don't see when you look at the sperms under the microscopes.
scope.
Yeah, you need to do some high level of functional testing to know that these sperms are really okay, especially when the sperms are in their millions. You
Exactly.
understand? So it's kind of dicey.
Yeah. For the sake of someone watching for the first time, a bit about Dr. Ken. He's a consultant gynecologist. He's a minimal access surgeon. As a matter of fact, he pioneered laser gynecological surgeries in Africa. He's also an IVF specialist, a fertility specialist, an excellent one. Yeah, a fertility specialist for excellence. I'd love to say. You can find out when you meet him. Yeah,
I like
so
that.
that's just a bit about Dr. Ken. But yes, let's get back to me. Men were out for you today.
No, we're out to help.
Oh yeah. In whichever way, we are still out for them.
Now, when you say you're out for them, it's like you mean
We've come
trouble.
well, no, not at all.
Okay.
Not in that sense. Of course, we are here to prefer some solution. A lot of times you have men struggle with this thing when they start hearing that issues are coming to them, because all pointers most times goes to the woman, and there's not something that a man easily embraces when they say he's actually the one that is likely the cause of infertility. And you have a lot of women bear that burden for years. You maybe they've said the man's sperm has issues, and then he keeps staying with his ego that I'm sure I'll be fine, and he's taking things privately and then wishing that everything will be well, and then this woman's age is ticking
Yeah.
and all of that. Are there things that actually, because I know, I just wonder in those days, because I hear people say that sperm seems to be on the decline. I just wonder what happened with those days when the sperm seemed to be better than now. Are there things that are actually really responsible for this whole decline with sperm, the quality and all of that for men in general?
Yes, there are quite a number of things, but one common reason is uh, the advanced civilization, modern life
Oh,
exposure to environmental hazards, which include electronic gadgets. You
gadgets.
know,
Oh,
the lifestyle, diets, the chemicals we consume in the name of medication, uh,
yeah.
cosmetics. Men
Hmm.
use cosmetics too, you know. Yeah. So environment we get exposed to and all
Wow.
of that
Hmm.
are some reasons why the decline in the quality or quantity of sperms that we see
Yeah.
today.
Yeah.
You know, so those are just the reasons. These
Wow.
things were not necessarily rampant in those
Back then.
days, you
Hmm.
know, the pre-millennial era and all of that.
Yes. Yes.
So life was a little bit traditional,
Hmm.
you know, and sperms were better.
Mm-hmm.
But today, you know, an average man in Africa has two phones. You know, the
Hmm.
phones are in the
Yes.
pockets. You get
Yeah.
exposed to a lot of radiation from the phones that affect the functionalities of sperms in a way and affect fertility.
Yeah.
You know, exposure to hostile environment, radiation prone environments,
Mm-hmm.
you know, they affect generally the cells in the human body. The sperms are not spared. Then the diet, and more
Take.
importantly, the stressful lifestyle of men
Hmm.
now.
Stress.
uh, Talk about oxidative radicals that stress bring on in men. You know,
Yeah.
this can actually affect the sperms, and so you have quite a number of reasons why sperms should be deteriorating.
Wow. So it's a lot, and that's also a call up for men to work on their lifestyle, just for you not to be a victim of the decline with respect to the quality of the sperm. So and that's what we're also talking about when male fertility needs surgery. Because I know most of the time it seems, I would say, I don't know what to say, whether to say women seem to be the one that are more open to going in for surgeries, even though it's not easy, or maybe their surgeries look more complicated when it comes to fertility than for the men. But men, there are still times that they need surgery. So we'll be talking a bit about why, when do they really need surgery? What are some health conditions that they might possibly be dealing with, or what are some issues with the sperm that might have been observed that, okay, we now feel like this person might be needing a surgery? Yeah.
Okay, so I like to start from boys.
Okay. Mhm.
You know, when boys are given birth to, I mean,
Yeah.
those days when we were young residents,
Yeah.
and then we go take deliveries or do an operative delivery and bring out a male child.
Child. Yeah.
One of the first things we do is to, I mean, part of the examinations that the medical team is expected to do is to check the testicles of the babies
Mm.
to see if the testicles are in the right place in the scrotal
Yeah.
sac down there.
Mm.
You know, one, because they may not have descended.
Mm.
One or both may not
Have the
descend.
same. Mm.
And if the testes are not in the sac, you know, there's a big problem that you may have to deal with later.
Later. Mm.
You understand? So, one, it means that the testicles are going to be in a hostile
Environment.
location, probably in the uh, abdomen or pelvic cavity, where
Wow.
you have an unnecessary exposure to heat that can damage the testicle. I mean, the sperm forming cells. You know, so if at birth and few weeks after
After.
birth, a baby is noticed who is a male not to have testicles in the testicular in the scrotal sac,
Yeah.
then of course the attention of the urologist should be sought for. You know, should be sought for, and the baby should be evaluated,
Yeah.
because if the baby grows neglected
Hmm.
without testes in the right location,
Yeah.
one, you're going to kill the ability to produce
Oh my
sperms. In
goodness.
addition to that, you're going to get the baby prone to having some malignant changes with the testicles wherever it's located. And then even if one testicle is down there and the other is
It's
up
still.
somewhere missing
Yeah.
or in an unknown location, you know, there's this syndrome that whatever happens to one is likely going to happen to the other.
other.
So the other one may be affected in its capacity to produce sperm because testes are two.
Yeah.
So why I'm saying this is that I've seen grown men,
Wow.
looking like hunks, beautiful men, fully developed, you know, only to find out they have no sperms
sperm,
at all.
exactly.
Find out they have no sperms.
Yeah.
And it's devastating.
Really.
When you take history a little, you find out that their parents neglected taking care of them as babies. And now they have to be faced with surgery without prospect. Because at that point, if you're doing a surgery, it's just to prevent malignant transformation or chances of developing cancer from that missing testis. Not necessarily to save the testis, because the testis will have been dead by then. I mean, it will have been bad and not functional.
Yeah.
In this case, you do the surgery to just for the sake of health of the man, but then he may have to use a donor sperm because he may not have sperm if the two testicles are involved or if the other testicle has been compromised. That's one. Another condition, which is not directly reproduction, we'll get to reproduction in a bit, is when men have testicular torsion. A man may just be having pain in the testes and be maturing the pain, neglecting the pain, not knowing that something is really happening with the blood supply to the testes. And now there is a golden hour for this kind of abnormality to be detected, diagnosed, and corrected. If you leave it for too long, the testis may twist around itself and then cut off the blood supply. And then you'll be dealing with dead testes. So even when you correct it later, the testis is dead already. You are lucky if the other one is spared. But of course, it means you have been compromised. So when men have problems with testicular pain, very bad testicular pain, it's going to be good not just to see a general doctor, but to see the urologists, the doctors who are specialists in dealing with the male reproductive organs, like the testicles. So corrective procedures are going to be done. We've seen people who have sued facilities because this wasn't diagnosed in good time, and the young child testicles was compromised, because this is a problem for the future. So if you correct testicular torsion, that you catch it early and correct it, you save the testes. And the surgery is pretty straightforward, and for the experts, easy surgery. You understand? So these are some very interesting things that are not necessarily fertility related, but have a long-term effect on fertility. So now back to what we're supposed to be talking.
Yeah, so we're back to fertility issues that might require surgery. When does a male fertility, or when is a male fertility compromised that surgery might just be a way out for the person?
Okay, so one of those areas where surgeries may be way out, it's when we have one kind of lack of sperm called exospemia, but it's caused because of obstruction of the sperm duct. There is a duct. There's a duct that transfers sperms from the store externally. Sometimes infection or some adhesions or trauma can block it. In this case, the man produces sperms, but the sperms can't be ejaculated. So they're just there in the storehouse. In this case, he finds it difficult to make his partner pregnant, because there are no sperms, no pathways for sperms to be ejaculated. So in this case, he needs surgery. But it means the wife will have to get pregnant by assisted reproduction. So what kind of surgery in this case? It's a surgery to get to the testicles or to the epididymis where the sperms are stored and extract them. Call it a minor procedure, yes, but it's a surgical procedure. You extract the sperms and then use the sperms to inject the eggs or to treat the eggs of the wife outside the body. So here you require surgery. And this procedure can be done in two ways. One, you can cut directly into the testicles and extract sperms. Or secondly, you could use a needle, a specialized kind of needle, to target the storehouse after due evaluation to be sure that there are sperms in the storehouse. Then you can syringe them, you can aspirate them, and then use them. The only challenge in this situation is that sometimes these sperms will have been trapped there for a long time. And they may have been exposed to oxidative stress, so their qualities may be compromised a bit or even so much. Then in the case where you're extracting the sperm from the testicles, you could get the sperms at different level of maturation.
Yeah, that's true.
So you could get sperms that are not reach full maturation. So where you have facilities, you could culture the sperms and watch them, wait for them to get to matured state, then use them. But when the facilities are not there, you just go with treatment and hope that you get the best. But then the sperms, it's good to mention, sperm getting through this means it's okay. But then several researches and studies shows that the pregnancy rates from this kind of aspiration or procedure may be lower than when sperms are ejaculated. But of course, you can't ejaculate sperm, so this is what you have to deal with. There are no other ways to go about it. One, you're dealing with oxidative stress, because it could have accumulated a lot of radicals. And secondly, sperms at different level of maturation. So those are just the challenges. So this is one way when the sperms are blocked.
So maybe those people should have had vasectomy.
Oh yeah, no, we see a lot of guys who do vasectomies. They can have this too, because usually the corrective procedure for vasectomy is not often successful when you want to connect the ducts. Not very successful, and then you could just get to the testicular storehouse and extract the sperms, and use them. So yes, guys who have vasectomy as family planning would benefit from this one too.
As much as that's not common in African society, but in the Western world, it's very common. Yes, it's very common.
Yes,
but we've also seen.
So in what we see a lot in this part of the world is what you call functional azoospermia, when it is not because of just blockage, but because of maybe disease condition that has damaged the testicle, damaged the epididymis, and so sperms have just not been formed. So when a man has no sperm in the ejaculate, first of all, try to investigate to decide what kind of problem he has, whether it's a functional or obstructive. We are happy if it's obstructive because it means there are hopes we could get sperms. But if it is functional, it becomes a problem. The individual may benefit from sperm donation or sperm bank services.
Okay, well, so viewers, this is just a part or a bit of some of the surgeries that are required. I know there are still a few more that Dr. Ken will talk about, but this is also to let you know that even when you've been diagnosed with something, you also have to get to the root of it and don't just assume that's the end. You have to be thoroughly evaluated. And just in case you've just been given a diagnosis and you didn't get a clear picture of what you are, then it's good that you go to a very good facility like you have at House Hospital, where everything will be well explained to you, and then you know what you're dealing with and you'll be told the way forward, as long as you have an open mind to embrace whatever counsel it is that is given to you. Are there some more surgeries that they could?
Yes, one common area is varicocele. We deal with varicocele a lot, and varicocele before now, significance of varicocele is not well established, in the traditional medicine, but in the field of assisted reproduction and andrology, for instance, we know that when a man has varicocele, by the way, varicocele means abnormal blood vessels, the veins, are engorged, enlarged, and tortuous all around in the scrotum, in the testicles, So what they do is that they increase the heat to the testes, and they limit the flow of blood away from the testes. So that way, they keep a lot of heat, a lot of metabolic wastes around the testicles, and a lot of oxidative radicals in the testicles. So these affect the sperms. affect the DNA in the head of the sperms, affect the nature of the sperm, affect the function of the sperm. Now, it does not necessarily mean that when a man has varicocele, he can't be able to make a woman pregnant. No, a
Yes,
good number
okay.
of men make women pregnant. But this is when this becomes important when infertility is the issue you are dealing with,
With.
because you want to get the best sperm and the best egg. So you have
Yes.
to create the environment for the sperms to be optimum, because IVF has a lot of variables, a lot of confounders, a lot of things that could affect it.
Yeah.
And so you want to deal with every possible abnormality to increase the chance of the
Chance of
couples to
success.
get pregnant. So where there is varicocele, for instance, usually varicocele now can affect the quality of sperms and all the things I've mentioned. So it's advisable to take out these veins so that the sperms will grow in healthy environment. When you take out the veins, you minimize the heat on the testes and you eradicate the abnormal waste product, the metabolites that needs to be taken out, and then the sperms can grow in a healthy environment,
Okay.
and then their functions can be optimized. So, in fact, it is recommended that before IVF is done, if there is varicocele, it should be removed. They should be operated. They should be operated.
So
So that's one.
okay.
Yes.
So now you're saying one, maybe there's two.
Yeah.
Okay.
And the surgery is actually pretty easy. I mean, the urologists do that.
Yeah.
We've watched it several times and we've partook in it. It's usually a day case.
To be working and go back
And you
same
just
day.
walk in, have it done, then you go back the same day. It saves. We've had guys who have just done only varicocelectomy, and just get
Pregnancy.
pregnant
Oh,
immediately
wow,
without
wow.
requiring the
Amazing.
IVF. While for those who need IVF, go ahead to do IVF with
IVF.
improved sperms. Now, aside varicose veins,
Yeah.
we have a hydrocele, for instance.
Okay.
This is where there's a collection of fluid. Let me use water. Fluid around the scrotal sac. There's a special space in the scrotal sac that water can collect because a lot of layers surrounding the scrotum. So water can collect there, and the water comes from the body, peritoneal fluid, water in the cavity of the body, just finds its way there because the body is all connected, when there is a defect around there. So this water is also hot. I mean, the testicle is supposed to be at lower temperature. So if you have water coming from the big body and flooding the testicles, making it big, buggy, heavy, and all of that, so it hits the testicles, and that can affect the health of the sperms. So if fertility is a problem, aside weight and dragging sensation that it causes, it needs to be operated so that the sperms can also grow in healthy condition. We call the kind of surgery varicocelectomy. For the urologist, is a basic procedure to do.
That's for the varicocele now.
No,
With
for the
varicose-
hydrocele.
So for hydro.
Sorry, yeah.
Okay.
Good.
Okay.
Thank you so much.
I'm
It's called
learning.
hydrocelectomy.
Yeah.
Hydrocelectomy. Yeah. Varicocelectomy is for the veins.
Yeah.
Yeah. Hydrocelectomy, it's for the collection of the bag of waters. Yeah. So another one is hernia.
Oh wow.
Yes. Hernia can also affect fertility.
Please, you should bring your ears closer.
Because
let's
hernia
learn
means
something.
intestine finding its way through the groin. There's a canal we call inguinal canal down in the pelvic region, finds its way there, and some of the hernia goes straight to the scrotum. And so it makes the scrotum so big.
Wow.
And then its intestine is a worm of intestine. So it's having a lot of heat and warmth.
Wow.
So it's also good to fix it when guys are going through fertility care so they can produce sperms in the healthiest of environment.
Wow.
So you see, so these are all the things that indirectly have bearing on the health of sperms. And to culture healthy sperms, you need to take care of them.
Very true. So there's a lot of wealth of knowledge that we've gotten from Dr. Ken today. I mean, a lot of people pay to get this information that you're getting first hand from Dr. Ken. Thank you so much, Dr. Ken. We have a question coming from Hamidat from Facebook. So she's asking what the remedy to dead sperm cells in male could be. I mean, what she's
Now it depends on what's making the sperms dead.
dead.
It could be a metabolic disease making the sperms to be dead. For instance, guys that have diabetes, uncontrolled diabetes, usually have problems with sperms.
Sperm.
This could deaden the sperm. Chronic infections could make sperms to be dead.
Wow.
Abnormal hormones can affect sperms, especially in men.
Wow.
Yeah, and so many other things that could make sperms to be dead. So it's good to identify what the cause is. Even the varicocele can make sperms to be dead.
Dead. Wow.
So it's good to identify what the cause is before you talk about remedy. So you can't remedy what you don't actually know what the cause is. So yes, we see dead sperms a lot, in different proportion. Yeah, we're not worried when the dead sperms are fewer, because every collection of sperms will definitely have dead sperms. Because sperms are alive, they die, and another one reform and all of that. So, but when all are dead, it's a big problem.
Yeah.
So it's good to look out for what is the cause of the sperm abnormalities. Then it's easy to fix.
So, Hamidas, hope this answers your question. For I don't know who you're asking for, just in case it's even you or someone, they could actually, and they are still finding some answers to why they are having dead sperm. Maybe they've not been thoroughly evaluated. So you could book a session with us at House Hospital. There's a number that will be displayed on the screen. You could also reach out, book an online consultation, or you could see us in any of our centers at Abuja or in Jos. And yes, you would get every necessary information, attention that needs to. I'm sure they will definitely find answers to the questions that you have as to why you're seeing the dead sperm. And then if there's a solution, I'm sure that you'll be sure to get such solution at our hospitals. So viewers, it's been good to have you. I know there's a lot to talk about with fertility. For the men, I know that sometimes we shy away from these things, but it's like research have shown now that infertility too is hitting the men. It's almost 50%. Just the way before they used to say it's only the woman, but now fingers are also pointing equally at the men, and that's why you can't afford to close your eye to these things. You have to keep checks. Even when you're dealing with fertility, do not keep pushing the woman to check herself and assume that all is well with you. Please check yourself and be sure that you're checking in the right place. Find a good place where you're sure you have a good fertility specialist. And yes, if you can reach us, why not? We're always there for you. Well, Dr. Ken, what's your counsel to people as we round up the show? What's your general final words to people on this topic today?
So my closing words would be sometimes the sperm abnormalities may be genetic, and then it can be progressive. So that means if you see 5 million sperms today, the next time you're checking, you may be seeing 3 million, and the next other time maybe 1 million, and all of that. So this kind of people who are established to have, you don't find a cause necessarily when this is happening. So often it's genetic programming of the body, and so they quickly get out of sperms. So those category of people who haven't yet fulfilled or achieved their fertility potential or have raised a family would benefit from sperm freezing. So that they just have sperm stock in case they want to have babies with their sperms later, so they don't get to a place where the sperm is totally zero. As I speak to you, there are some countries actually that do this currently. And I advise men with low sperm count who haven't had babies to go freeze the sperms. Just the way we advise young ladies who are not yet ready to have kids for any reasons, or having some form of cancer treatment to freeze their eggs. Men are also advised to freeze their sperms because you just don't know.
Exactly. So you never say never. But now you mentioned, I just remembered a mother that actually brought her son to come and freeze sperm. I think maybe they had an event with him maybe some years back, and she felt okay, he was man enough to come freeze his
Mm-hmm.
sperm to just be
Mm-hmm.
sure, because they had
Mm-hmm.
their worries and concerns
Mm-hmm.
that something might just go wrong
Oh
later
yeah.
on based on
Mm-hmm.
what he had to deal with. That's a mother that is thinking about the
Oh yeah.
future. And so it's not out of place. So please take that counsel very seriously so that you remember today. So after
Yeah.
today, please come and freeze your sperm.
Freeze the sperms, man.
Yeah, so we
And that's not all. Then we're
mhm,
talking about freezing sperms.
mhm,
Military guys should also explore the option of freezing sperm because you
yeah,
see, there's one thing about military life is very uncertain. Often you go for missions and
you never know.
missions are crazy.
Yeah,
And then a good number of them are just about to get married or whatever it is. So freeze the sperm and sign consent what to do with the sperm,
exactly.
whether you are alive or not, and give consent to what the sperm needs to be used for. And who should have authority over the
About the
sperms.
sperm.
Otherwise, freezing makes no sense if you're
Exactly.
not alive.
Yes, that's
So
right.
I think guys should look quickly into this, but you'll be wondering that this is Africa. We're dealing with hunger,
Yeah.
we're dealing with
So,
poverty, we're
mhm.
dealing with insecurity, and all of that. But life must go on.
Yes,
There are those that have
absolutely.
capacity to freeze.
Why
Yeah,
not?
because even the people who are socially incapacitated still have babies. In fact, they have more babies than those who
I do.
are
Oh yeah,
economically
very true.
empowered.
Very true.
Yeah, so that's it. So just freeze it.
Thank you so much, Dr. Ken. Viewers, I know, I trust, and I know already that you
Maybe
guys
I
had
should
a good.
freeze too, man.
Yeah, so okay, so viewers, it was good to have you, and yes, we had a good time with you, Dr. Ken. On behalf of me and our followers, we are saying thank you. We had a good time.
The girls should freeze their eggs too.
Okay, yeah, freeze your eggs and thank us later. Viewers, thank you so much for engaging us. It was a good time with you all. Please continue to stay tuned. Continue to look up for our posts and always like, share, watch our videos, because there's just a lot of knowledge to gain from them, knowledge that you don't easily find. So please do not close your eyes to those videos when you see them. Make sure you watch. Make sure you watch. Make sure you also share the videos. And yes, you'll be glad you did. Thank you so much, viewers. We look forward to seeing more of you in our next episode. But for now, have a good evening. Bye.